Hi there, this is Dr. Anna Lowe, and I'd love to share with you another wonderful success case that we typically see at the Happy Health Institute. Once again, I'm Dr. Anna Lowe. I am an integrative functional medicine doctor, family medicine doctor. So, this is a 36-year-old female. She's South Asian, and she came in and saw me for brain fog, anxiety, really debilitating PMS symptoms, PMDD, which is just really severe mood swings and irritation about 10 days before her period. She's also always exhausted and have history of hypothyroid even though she's on medication. And she's also just having a hard time losing weight. So disclaimer, this is not really intended to treat you or diagnose you or for you to do the same thing, or it's really kind of an opportunity for you to see what are some cases and opportunity for people to feel better with similar symptoms. It is not intended to replace medical advice from your doctor and the personal care from your healthcare provider. So please consult your doctor or healthcare provider for any advice about your specific medical condition. So this patient's why she came to see me was she has stubborn weight. She could not lose weight. She's had, very bummed out about her weight. In fact, she's obese. She has a lot of tendonitis pain, plantar fasciitis, tennis elbow, and it just goes around from different place to different place over the course of the last few years. She's unable to focus, unable to plan her day. She feels really scattered. She almost feels like she'd like to get an ADD diagnosis for attention deficit. That was kind of her next step, or her recommended by her doctor. She has terrible PMS and mood swings, severe fatigue, hypothyroid, even though she's on medicine, and she's very fearful and anxious all the time. Her goal, I said, well, what would you like to see yourself, right? If you get to shoot for the moon, what are some things you'd like to feel? And she said, I'd love to have more self-expression, less mental focus on my body, but more on my health and well-being and happiness. She wants to stop snoring because her boyfriend keeps mentioning she snores really loud. She wants more vitality. She wants to move again, dance again, have more libido. So previous treatments tried included, being on thyroid medicine. She's had therapy. She's, however, been just always told she had normal labs. And so despite it all, she has not had any other treatments. So what are some clinical pearls in working with her? First, it was a detailed visit, getting a little bit more deep dive into history. She does have a history of a lot of shaming, a lot of bullying when she was younger. She does have trauma around that. She also has traveled extensively, especially back to India, and had a lot of traveler's diarrhea from what she remembered. So when we did the labs, we focused on what were some of the things that showed up, right? Her fatigue. So we really looked at her thyroid, and it was clear that her antibody was still very high. She was still having active autoimmunity. Rather than just having controlled thyroid numbers, she actually had uncontrolled inflammation around her autoimmunity. When we looked at an organic acid test, which is a urine test looking at different processes in her body, we see that around her dopamine metabolism, she's lacking. She's showing a slower process, and then there's also showing that there is indicator that there's abnormality in general, around her neurotransmitter, around antioxidant, and around detoxification, and around, gut health. So there's a lot of different things going on, and it's giving clue to her processes. There's stuff that's not working. And then when we did a stool test in her, because when we have someone with autoimmunity, it's important to see if they have any gut issues around absorption, digestion, or causes for inflammation. In this case, she does show that there is parasites showing up, and there is low healthy flora, and suspicious of dysbiosis. And in a different test, there shows that she does have leaky gut, which is kind of like, imagine your gut walls are they're leaky. They're holes where infections, antigens, irritants can go through to your bloodstream on the other side of your gut wall, which is normally supposed to protect you. Now it's over and leaking into your bloodstream and causing inflammation. And so, knowing these really key findings, we treated the leaky gut, we treated the parasite, which is a very typical reason why the person still have, high inflammation or autoimmunity. We supported her hormones, right? With a short-term bioidentical hormones, but really supporting her lifestyle, stress management. We balance her blood sugar, especially around her hormones, right, with PMSs, PMDD, and with weight issues. That is number one. So we balance her blood sugar with healthy habits, really understanding the mechanism, changing her diet in a way that actually is not taking away things, but helping her really understand how to make better choices to maintain her blood sugar. We found out because she has a methylation SNP, so an MTHFR gene that we tested with heterozygous, we support her methylation better so that she is less inflamed. And we change her lifestyle, right? Help her have better mindset, help her start being more aware, right? When you think about meditation, it's not necessarily just doing completely quieting your mind. Sometimes it's just awareness. And then have her actually understand what kind of food is anti-inflammatory. And as a result, she actually, her general score, toxicity score, MSQ is this general symptoms questionnaire I ask that covers all different symptoms from head to toe. When she first started seeing me, there was 96 points positive, and it became 23 points just over 6 months. Her marker for anxiety and depression score has drastically gone from moderate to very low. She started having so much energy. She's able to wake up and go exercise and do high intensity training, interval training 3 times a week because she enjoys it now rather than dragging her feet. Her anxiety and depression much, much resolved. Her PMS and her PMDD is much more minimal, meaning that she has less cramping, less moodiness, or shorter periods of times of just gut, discomfort. She wake up feeling energized and she goes work out. She feels more focused at work and she feels even more purposeful. She feels the way she said it, she's like, I feel the opposite of being scattered. And finally, she's losing weight now especially around her neck and chest area. She's breathing much better, and it's also helping her sleep and not being snoring. And she's just more vibrant, feels more, just balanced hormonally too. So for the next step for you, if this feels like there's parts of you that identify with this, the best thing you can do is to become a patient. Reach out to analowmd.com and look at my program and contact us and schedule a discovery call with me. Or if you want to just learn more about my methods, register at the 14 Days to Health by going to the website and sign up for the free video series. Or if you feel like if you're out of state, not in California, you can always get a lot of what I educate patients on. And that was really helpful around reversing a lot of the fatigue, burnout, and hormone balancing by enrolling in my 4-week online course. So that's it, and looking forward to support you.